I have a very good friend who was a doctor and a researcher at Stanford, and he committed suicide recently. Nolan, you heard about that. And he actually was leading the effort to find a way to get patients who have severe depression and are suicidal to get out of it. He had done so much research and had made a lot of progress. But in the end, ironically, he committed suicide. So we don't appreciate how hard that level of depression is to treat. What role do you think brain-computer interface can play in that?
What we see right now is that there have been a lot of successes with device-based therapies for depression. There are brain stimulators that can help people who have severe depression. Well, I would say that we don't have right now in the market, or even really robustly in clinical trials, are ways of reading out when those things are working other than clinical readout, like how someone reports their mood. I think what I'm most excited about that brain-computer interfaces can do for depression, obsessive compulsive disorder, post-traumatic stress disorder, mental health in general, is that they can read out mental states. The same kind of devices that can read out whether someone's intending to speak or intending to move can read out things like if they are feeling depressed. And I think if we want to look at diabetes, for instance, one of the biggest breakthroughs in diabetes treatment was the ability to measure blood sugar. I remember my grandfather had diabetes, and just being able to do the at-home finger prick was a big deal. He died before continuous glucose monitors were available, but now people with diabetes live a much more empowered life because they have the ability to have real-time for
Talk
mental
about
health.
that too, actually. I'm glad you asked that question. Talk about what is the potential for these implants in helping us develop the treatments for them?
Well, if we had markers for things like depression, compulsion, obsession, then we would know when medicines are working. We would know when neurostimulators are working. We'd be able to have a feedback loop that happened without us having to consciously be reporting to a doctor, and it could be very fast. And so I think that's quantifying mental health and making it available real time in the same way that a continuous glucose monitor makes glucose levels available real time. That's how we're going to really make inroads on mental health in a way that we can't right now.
It's interesting that I don't know if any of you have ever been to a psychologist or psychiatrist's office. If you fill out the form where they say, do you have this, all of us have every disease. Because it looks like, oh yeah, sometimes I do think that. Sometimes this happens too. So the point is, when we have to report our symptoms and how we're feeling and what we're really doing and how we're doing with the medicine is not so accurate.
Even just what level of pain do you have?